Hello, everyone. This is Jeff Wright. I'm one of the co-chairs of the ISPGR World Congress and going to be held in Brisbane this summer. I am here with Professor Li-Shan Chou, and he's one of our keynotes. He is a mechanical engineering by training, and he has applied that training to biomechanism, being a biomechanist. And he's going to tell us a little bit about what motivates him to do the research that he does, and then I'll ask some other questions. So, hello, Li-Shan, welcome.
Good morning, Jeff. Yeah, it's good to see you, and hello everyone who are the participants to the ISPGR meeting in Brisbane, Australia this year. Yeah, my name is Li-Shan Chou. Yeah. As Jeff indicated, I was trained as a mechanical engineer. Actually, my original or initial research is about working machine, how to design a working machine which can work like a human. And suddenly I realized, when you are building a machine, you actually learn from the human. Then there are a lot of questions about why humans work this way and that way. And that prompted me to kind of think about more about then. Maybe there are a lot of things we have to learn about ourselves. And then I also realized that clinically, there is a discipline called biomechanics, which I can work with orthopedic surgeons and the physiatrists in the hospital to use our findings for the betterment of improving patients' treatment. So that's kind of the patient I have, and I decided that that's the direction I want to go for, and I want my data to be more meaningful to the health of the patient population down the road. So that's why I become a biomechanist, and I've been doing that since the early 90s up to this moment.
Wow. Yeah, and I know you've worked with some traumatic brain injury populations, with some older adults now with fall risk. You also have worked, as you mentioned, with orthopedics. Some of your newest techniques are involving some modeling. Do you want to tell us a little bit about the modeling techniques that you're going to present in your keynote?
Yeah. So in my keynote, I'm hoping to kind of cover the chronic spectrum about my research development in my effort of examining gait balance control in human walking. And so, yeah, we have fortunate to be able to identify a few biomechanical markers which can allow us to sensitively detect gait imbalance and also to quantify risk of falling. And recently, we have been thinking about more toward to the intervention side, that how exactly, after you can identify those high risk of possible fallers, then how can you help them? And certainly one of the areas we are looking into is, for example, muscle strength strengthening, and how exactly we can help them. And so we currently are using the OpenSim musculoskeletal modeling as a way to help us understand how does each of the lower extremity muscles contribute to the control of the whole body center of mass motion during locomotion. And then at what instant of time, which muscle contributed to the most, for example, during the normal population. And then what is happening to a specific elderly individuals whose muscle may activate differently. And then by knowing all those information, then we are able to maybe work with physicians to design a muscle strengthening intervention to help that individual to be able to activate the muscle in a much normal fashion, and then to be able to control the central mass in a more stable manner.
Yeah, that's fantastic. You're covering from basic science, basic engineering, applying that, translating it into applications, and you're going to be showing us some of your latest work, not even published yet, right here at ISPGR in Brisbane this summer. So thank you very much, Li-Shan. You have to come to ISPGR in order to hear some of his latest research. So we'll see you all there, and that's it for now.